Time now for a look at your health. It's either loathed or loved, but however you feel about it, chances are if you're an adult woman, you're taking it. We're talking about birth control today, and it's tough to pick out the right one for you. So here to separate fact from fiction and answer some of the questions you might be afraid to ask your own doctor is Dr. Mitchell Goldman from UCSD. Thank you for being here.
Good to be here.
Let's talk about some of the common beliefs when it comes to birth control. We actually have this spelled out on the screen for our viewers. Does it actually make you gain weight?
Usually not. Some women will get a little more bloated or retain fluid, but the majority of women on birth control pills do not gain any weight.
What about acne?
Acne, some pills will make them actually worse, but most of the pills, especially one called Yasmin, actually makes acne better. And dermatologists will prescribe pills like Yasmin to young women to actually treat their acne.
And if you're on antibiotics, is it a concern that you're also on birth control?
You know, some antibiotics like penicillin, amoxicillin, something called rifampin, can actually decrease the efficacy of pills. The way a woman would know is if they start to have some spotting or breakthrough bleeding, then absolutely you have to do another form of birth control.
When I was very young, I was put on birth control pills and they made me so sick I could never take them. I was nauseous, or I was either so hormonal I didn't want to get them out of the bathroom. They just did not mix with my body. But I was told to take them because they can reduce ovarian cancer. Is it true that birth control pills can curb cancer?
Oh, absolutely. Birth control pills will decrease the incidence of ovarian and endometrial cancer. Now, interestingly, birth control pills may increase the risk of other cancers like liver cancer.
But not really female cancers?
No. The only, about breast cancer, we're still not really sure. With breast cancer, it's more of having your first pregnancy after age 30, having menopause coming later, having periods coming earlier. The birth control pill, not a big factor, but definitely decreases ovarian.
Well, a lot of women are having babies later on in life these days. That seems to be a part of our culture. And there's a concern that if you take birth control pills for a decade, you won't be able to conceive later on. Is that a true statement?
No, that's a myth. You know, it's common that when someone, let's say in their late 30s, finally gets married and they want to have a kid, they think, oh, we have to wait or it's going to take about a year to get pregnant, and boom, they're going to get pregnant right after their wedding. So you can really get pregnant. It has nothing to do with taking pills.
That's an important one to write down, folks, because I get that question a lot from my girlfriend. So talk about some other forms of birth control and their effectiveness, because you had some interesting statistics.
Yes, the only thing, of course, that's 100% effective is saying no.
Abstinence?
Right, but taking the pill about 99%. Interestingly, using a condom, only 85%.
Despite what it says on the label of the box?
Yes, but 85%, but condoms break. People don't use them properly, and so you have to be really careful if you're using a condom. They protect against a lot of sexually transmitted diseases, but only 85% effective for birth control.
Very interesting. You shed some light on a lot of those questions we're too embarrassed to ask our physicians, so thank you.
Oh, it's a pleasure.
Nice to have you as always, Dr. Goldman. We'll see you next Tuesday. Sure.